Ceann Comhairle, first of all I want to welcome the fact that we're having this debate today, which I've asked for on the order of business over the last 2 weeks, and I want to thank my colleague Deputy Emmett Stagg, who has been pushing for it at the Whips meeting. I just first of all want to assure the Minister that we are absolutely and fully supportive of a good, accredited, safe programme in relation to cancer screening, whether it be cervical or breast screening or any other type of screening. But I also want to say to the Minister that I don't know whether she intended it or not, but there was certainly an implication in her contribution that that was not available in this country, and that is absolutely not true. We have accredited laboratories, we have a very high standard, and the implication that by giving this contract to a company outside of the country, that we didn't have that expertise in this country, needs to be clarified, and I would urge the Minister in her response to make that clear. I also want to welcome the fact that the Minister has said that while Quest Diagnostics is the preferred bidder, that the contract is not actually signed yet, and there is some time, and I would again urge the Minister to listen to what we are saying in the House today and to what has been said by other people who are very concerned about the decision to outsource the entire cytology screening in the cancer screening programme for cervical screening. And just to quote one source of concern is the editorial in the Irish Medical News this week, which again expresses serious concern that our outsourcing the entire service is not the way we should be going. The awarding of the entire contract for the Irish cervical screening programme to one bidder, Quest Diagnostics, which is a US-based private company, will result in the loss of jobs and skills that the government cannot ignore. This is not just a matter for the National Cancer Screening Service. And I want to stress that, and the Minister has again said that it's their job and it's nothing to do with her, nothing to do with her department. But its consequences are of national concern. And I would suggest that we're being penny wise but pound foolish, and that there are serious long-term consequences in relation to this decision. It's important to set the decision in the context in which it happened. The Irish Cancer Screening Programme was first established as a pilot programme in the Midwest region, and that's the region I live in. The intention was that this programme would be evaluated after a period of time, any necessary lessons would be learned, and a national programme would be subsequently rolled out. I and thousands of other women in the Midwest have benefited from this screening, and I very much welcome the fact that it is going to be available to women in the rest of the country. And again, I want to stress that the Labour Party is fully supportive of the need for the highest standard in the quality of the screening methodology and the expertise of those who carry out the tests. There is absolute agreement on all sides of the House, and indeed throughout the country, on this. But what deeply concerns us is the awarding of the entire contract to one private non-Irish company to the exclusion of all the Irish laboratories. And this puts accountability at a further remove. And I don't think that this is a good idea. We're separating cytology from other aspects of patient care, and this will not result in an integrated, patient-centred service, and that is of vital importance. A number of measures were identified during the pilot programme which would have to be implemented in order to roll out the programme to the rest of the country. These include the need to improve laboratory facilities, introduce quality assurance and accreditation, and train extra staff to facilitate the rollout. There was close cooperation between the pilot phase screening programme and the cytology laboratories in Ireland. GPs and other providers of service took the smears and sent them to a number of laboratories around the country. The laboratories did the testing and also set about improving their facilities and their turnaround time. And at least 3, if not more, of our laboratories in Ireland are now fully accredited, and others are in the final stages of achieving accreditation. The other significant action that was taken to prepare for the rollout was the establishment of a specific higher education course to train medical scientists to carry out the smears. This was one of the recommendations of the report by Dr. Euphemia McGugan, who carried out the evaluation of the pilot programme. This state-of-the-art course, Minister, is in place and is training highly skilled graduates at DIT in Kevin Street. It was set up at significant cost to the taxpayer with state-of-the-art expensive equipment and expert academic staff. If all of the testing is going to be done by Quest Diagnostics, all of that effort, all of that money will be down the drain. There will be no jobs for the students, there will be no cytology expertise in Ireland, and there will be no backup if Quest does not seek to renew its contract or if anything goes wrong in the meantime. We urgently need joined-up thinking in government on this issue before it is too late. The Minister cannot close her mind to all that has gone before and hide behind the independence she has given to the National Cancer Screening Service. Privatising and exporting the entire testing service has implications that are too serious to be decided purely within the narrow requirements of the National Cancer Screening Service. And I'm not going to have time to go into the argument as to whether Quest's methodology is inferior to the Irish model, though it has been claimed by those more expert than I that Irish screeners have doubled the specificity for picking up abnormalities compared to US screeners. And I'm not going to refer to the fraud charges either that have been highlighted in the media. These may or may not be relevant, but the argument I am making stands up irrespective of these factors. If a rare species of animal, bird or insect was threatened with extinction from our country, we would do everything, and rightly so, we would do everything we could to protect it. We must be equally vigilant in protecting unique specialist skills that our people need for the future. I'm not arguing that all of the testing must be carried out by Irish laboratories immediately, but a significant amount of it should be. The tendering criteria stipulated that there must be a 10-day turnaround, and the Minister referred to this, and that the prospective bidder must handle at least 25,000 samples per year. I understand that there were Irish bidders that fulfilled these criteria, and I have serious questions about why such strict criteria were set, particularly as the McGugan report suggests 4 working weeks as an appropriate turnaround time, and maybe the Minister would address that as well. And I take the point that she said 80% was for turnaround and quality assurance, but I would just question what part of that was the turnaround part of it, and why did it go down from 4 weeks to 10 days? And was that specifically to exclude Irish laboratories? Is this decision the precursor of more privatisation of Irish laboratory services? That's another concern. Are other pathology jobs at risk? Following on from the Minister's own co-location plans, which will separate public and private patients on the campuses of many of our larger hospitals, and which we in the Labour Party vehemently oppose, we are seeing more and more farming out of services to the private sector by the HSE and now the NCSS. Kidney dialysis in my own constituency is to be provided by a multinational company. 15 to 20 million euros has been paid to KPMG to administer the health repayment scheme. And even the letters to patients in the North East whose x-rays are being reviewed were sent by a private firm. It's hard to believe that there was any justification for contracting out that particular job. We are very concerned that this again represents more outsourcing, more privatisation and a failure to trust and invest in the Irish Public Health Service. I don't expect the Minister will share my concerns about the privatisation of cervical screening or of any other service. She is ideologically committed to privatisation, but I do expect your partners in government, in Fianna Fáil and the Greens, to be concerned about this continuous privatisation within the health service. And I do expect you and your government colleagues, Minister, to protect the jobs and essential skills that are needed for this country. And I expect you to care about educating young people and raising their expectations about pursuing a career in this country, only to shut the door in their faces. Minister, I'm strongly urging you to intervene before this contract is signed. And once again, I welcome the fact that you have said today that Quest Diagnostics is the preferred bidder, but that there is some time still available. And Minister, I would urge you to consider all of the implications of this decision, and also to consider the fact that we do have the highest of standards accredited laboratories in this country. We do have trained workers who are going to lose their jobs. We do have students currently in DIT Kevin Street who are training to work in cytology labs in Ireland. We are in danger of losing these skills to our country, and in 2 years' time the skills will be gone. Minister, I urge you to change your mind on this issue. I urge you to intervene, and I urge you to ensure that Irish laboratories are included in this contract. There is a national interest at stake. Thank you.